So welcome everybody. My name is Pratik. I'm from Bridge India and I'm in London, and we've got a great panel with us today. Bridge India is a non-profit think tank based in London. The aim is to help Europeans and Britons better understand India from a public policy perspective. Under these COVID times, India has fared much better than the UK has. We've had more than 40,000 deaths already, and there's no end in sight to the lockdown. But during this time, we've been doing weekly webinars on different aspects of Indian public policy. Tomorrow, we've got one on whether remote learning is here to stay in higher education. Next week, we've got another follow-up on how India can respond to more aggressive Chinese geopolitics, particularly on the border with India. And we've had sessions on the space sector and downstream opportunities in space just 2 or 3 weeks back. So we've been doing at least 1 or 2 webinars every week throughout this period. And our attendees are typically from around the UK, Europe, and India as well. So thank you all very much for joining us. Today's session is, in my view, a unique one because India has been leading the world in developing a contact tracing app. On the midnight of the 27th of May, Aarogya Setu, India's digital contact tracing app, went open source, being uploaded onto a GitHub repository. This was a significant step towards transparency in the collection and usage of sensitive data about COVID-19 patients. At that time, the app had already been downloaded 140 million times, and at that time represented, and still does, represents a contact tracing app set of downloads that's bigger than the sum total of all the other similar apps around the world. More than 3,000 hotspots at the sub-post office level have been identified as of a week ago, thanks to the app, and more than 1,200 potential hotspots detected. There are, of course, concerns about privacy protections, data usage, and the perception of intent from activists around India and around the world. The Internet Freedom Foundation has been at the forefront of efforts to address some of these issues. But since its introduction on the 2nd of April, what is undeniable is that the app has been extremely well received in large parts of India. That's evidenced by the fact that it's had so many downloads. Today's session is very much about learning why the app came about, how it came about in such a rapid manner, and we're going to hear from one of the chief architects of the team that built the app, Arnab, and then we'll hear from a couple of other users. So just a quick background to our speakers. Arnab Kumar led Government of India's strategy and implementation of AI, digital economy, fintech, and blockchain initiatives. He co-authored India's national strategy for artificial intelligence. He's an ex-investment banker from Deutsche Bank with an experience of more than $20 billion in M&A, equity, and debt transactions across Asia and the Americas. And if some of you have heard of the Atal Innovation Mission, he was the founding manager for that as well, and he's a CFA charter holder. Then we have Dr. Mohammed Wasim Gori. He's the Group Medical Director, Physician and Diabetologist at Heart and Diabetes Clinics in Mumbai, a chain of single specialty clinics. He was earlier in the NHS in the UK and England, and he's also studied in England as well. Then we have Kamlesh Nagwari, who has 10 years experience in software development and IT consulting, in trade finance, telecom billing, and he's got more than 4 years of experience in blockchain and hyperledger technologies. He is the co-lead of the Hyperledger India chapter and an active contributor in Hyperledger Healthcare and other working groups and communities. So I'm delighted to have all of you join us today.
Thanks, Pratik.
If any of you who are attending have questions, please use the button at the bottom which says Q&A and put the questions to the panelists. The rest of you can upvote the questions, and the ones that are upvoted will take quicker. In past sessions, we've had 20, 30, 40 questions, so we haven't been able to take all of them, but please do leave them there and we can answer maybe some of them on Facebook afterwards. So now, with that introduction, I'll just hand over to Arnab to tell us a little bit about how the app came about, the intentions of it, and the kind of success and some of the challenges he's faced.
Sure. So thanks a lot, Prateek, for having me on this conversation. It's an absolute pleasure to interact with you and interact with the rest of the people who have tuned in through a Facebook Live session. The story is a fantastic story because this is a story that shows that if there is a crisis, how the public sector and the private sector have raised their hands and come together to build a technology common, which was very much needed in times of a crisis like this. A few of us, some of us from the public sector, government, and a few of us from the private sector, we had the first idea of how to go about a contact tracing app around mid of March. And we said, can we build something like this? The first week, it took us to build a simple prototype on say a Marvel app kind of a solution, and say, can we now go and ask the decision makers, is this something that is required for the country? And the need was pretty evident. We were doing manual contact tracing. We were one of the first countries to start making sure that people who are coming from high-risk countries, we do a manual tracing of them at airports, etc. So we said, with the scale that India has, and if you have to look forward, and if this situation worsens, this is mid-March I'm talking about, how do we make sure that this process is automated and this process is also, again, a correct one? That was the main theme for us, how this process is a correct one and it's efficient. And if you look at the contact tracing, manual contact tracing, you can only tell about people that you know of. For example, Prateek, you and I know each other. If we have met and I turned COVID positive, I can say I had met Prateek. But for other people on this conversation, assuming we were not on Facebook Live, but in a physical hall, how would I tell others that I was COVID positive? How will I alert all of you? So that is one of the things and it was very intuitive to us that manual contact tracing can't work, especially at the scale that India has. And we said we have to build something. The technology development was very, very rapid. We had the first version of the app ready within 10 days. And we widely distributed that beta version to a select set of people around 25th March, if I'm not wrong. And by 2nd April, we had launched a full-fledged product in 11 languages, which we later extended to 12 languages. While we developed all of this, we did not compromise on any single aspect of the product. So we had thorough security testing, we had thorough privacy testing, and thorough scalability testing. I'll give an example of how paranoid we were about scalability. And this, you can call it our naive optimism or whatever you may call this. But we thought, what happens if every single one of us who has a smartphone in the country downloads this app from day one, which would be about 400, 500 million people. We had that kind of scale ready from day one of launch of the product. We also wanted to make sure that there are a few design principles that we had in mind. The first one was, this has to be privacy first by design. This is something that a lot of people have not understood well. So I'll emphasize as we go on in the conversation. The second aspect was, it should be super easy for everybody in the country to use. And India is a very diverse country. We speak multiple languages. A lot of our comprehension skills on phone versus conversational skills are not same across the country. And the third thing is that we use different types of mobile handsets. People have 3,000 rupees mobile handsets to all the way to a lakh and a half mobile handsets. How do we make sure that the technology works seamlessly across all of this, which is necessary? So our golden standard was, if India can run on WhatsApp and people are comfortable using WhatsApp, can we build a technology which is such a simple user interface? Whatever complexity we have to build, we build in the background. But whatever is in the foreground is simple enough to use. What was our philosophy, and it has to work like a charm on every single smartphone from day one, was the philosophy with which we built the product. We released this within 2.5 weeks of the initial design. That was 2nd April. And by 15th April, we had already hit 50 million. I'll give the example of how scalable we were. On 14th April, the Honorable Prime Minister endorsed the app and gave a call to the nation to download the app. On that day, at several instances, the number of downloads per minute were more than 100,000. And the product was scalable, the product was stable, and nothing happened to the product. We were so scalable at that point, at that scale also. So that has been the journey of the product. A bunch of us from private sector, from public sector. At the peak, we were about 50 to 60 people working on this. Now we are in maintenance mode, so slightly lower numbers. But that has been the overall story of the development of the product. From an impact perspective, I just saw we have hit 125 million. That's another milestone. We have gone from a concept to open source, from a launch to open source in 8 weeks. That's another achievement at 100 million plus scale. But more importantly, what we have achieved is what I'll tell you. of the 125 million installs that we have seen, about 2/3 of the people have taken something that we have in the app, which is called a self-assessment test. This is based on Indian Council of Medical Research algorithm for suggesting who all should go for testing. More than 2/3 of them have taken that test. Out of that, about say 2.5 million people have come across as symptomatic. They have self-assessed themselves as symptomatic of COVID-19. We have a set of more than 100 doctors dedicated to COVID-19 helpline who have called more than 1.6 million such numbers and found out if there's a problem, if we have to follow up on those COVID symptoms and see whether we can recommend them hospitalization, self-isolation, quarantine, etc. That's the first aspect of how the app has worked. The second aspect of how the app has worked is that out of all the people that are there on the app, about 30,000 people are COVID-19 positive people. Out of these 30,000 COVID-19 positive people, we have traced more than 500,000 contacts traced through this 30,000 plus people, out of which we have seen around 140,000 people who may have moderate or high risk of infection. And we have suggested them testing. Out of the 30,000 people who have been marked high risk and have been tested, more than 9,000 people have actually tested positive. So the efficacy of testing recommended by Aarogya Setu is around 25%. This efficacy is unparalleled for any testing protocol anywhere globally, not just India. To give an example, most countries have an efficacy of about 5% of the, or less than 5% of the people that they test and who eventually turn positive. And the third aspect is the number of hotspots that we have been able to predict at the sub-post office level. A sub-post office level is usually an area of 3 km by 3 km, 9 km square. And we have been able to predict these hotspots in some instances at least 3 to 17 days ahead of time. And where we have said, you need to put an intervention, we have seen that the hotspots have actually subsided. So this has been the impact of the product. The idea of whom to test and where to test is something that is a kind of advanced intelligence that we have been able to give to the central authorities, to the health authorities and health administration, basis which they have been able to plan their response to COVID-19 on a precise information basis. And that has always been the purpose of this product. The product is not a one-stop solution for all COVID-19 related issues that this country faces. The idea has been, can we provide advanced intelligence to our administrators so that we can buy time for our frontline healthcare workers and so that we can ramp up our infrastructure capabilities, which is doctors, nurses, healthcare workers. If we can get specialized instruments, ventilators, number of beds, etc., is what we have tried to buy time through this and tell people where you have to focus our limited resources at. That has been the approach to this app. This is a holistic approach that we have taken. Whoever self-assesses themselves at high risk, we follow up with them. Whoever are at higher risk, we follow up with testing of them. We make sure that the hotspots that have been marked are passed on to the administrator so that they can take suitable action on this. So this has been the success of the app from an impact perspective. From numbers perspective, we have seen, fastest to 50 million, one of the fastest to 100 million, open source at 100 plus. So those are all things that are a side note in what we are trying to achieve. Those are good things to have. But the impact that we have created in terms of actually helping people is something that we are extremely proud of. And we have seen very encouraging results, and we are continuing to keep developing and delivering on these kind of results.
Are there some areas of the country where it's been more successful, had more downloads? In places like Mumbai, has it been better, and rural areas maybe a bit far fewer downloads?
So the downloads have been uniform across the country, and what we have been doing is that we have been looking at the downloads across the country from day one and trying to focus our effort on informing people to download more in those areas. We have seen it across. One thing that people have to understand is that the smartphone penetration is not uniform across the country, and we have tried to address that. So urban, semi-urban areas is where this is more than, say, a rural area. That's why we'll probably see a penetration higher in these areas. What we have tried to do is that we have tried to solve for smartphone penetration through two angles. One is for a select set of feature phones, which is Reliance Jio feature phones. We actually have developed an app which uses a Kai OS. So that covers additional 150 million approximately users. What we have also done is people who have only feature phones and no other resources, we also have an interactive voice response system. So they can actually submit their conditions, etc., through a number 1921 and provide us that information. We have seen this across the country, and what we have been seeing is that we have been able to correlate where the direction and velocity of disease is and where most people have installed the app. So to give you a number, we are at 125, maybe there are 400 million unique smartphone users in the country. So we are about, say, somewhere shy of 1/3. We still need to try to aim for all smartphone users in the country, but that is where we are at this point in time.
Okay, okay. And what's the kind of critical mass you need of downloads to be able to say that across the whole country you have a very, very good picture?
So I'm not an epidemiologist. I'm not a population level statistician. So I don't have a number. So we have seen various studies. We have seen Oxford has put out a number of 60%, etc. So I don't know what number works for India. However, what I have seen is that at the scale, at 125 million scale, the ability to predict hotspots at such precise level ahead of time is something that is still working at this scale. And that is something that is very, very useful for us. So as I mentioned, where to test more is an insight that we are gaining from here. Of course, we'd want all of us to have this app on their phones, and that is what we have been proactively trying to get at. But even at this scale, we have seen phenomenal results, and I'm pretty sure as numbers increase, we'll see even more accurate results. And I hope people with systematic lifting down of the lockdown, I hope more and more people use this. There is this simple idea: if you have this installed, it's good. But if you are meeting somebody, encourage them to install it, because that is the only way both of you will be able to help each other. So that has been our request to everybody. But even at 125 million scale, we have seen phenomenal results that are proving to be extremely useful in our fight against COVID-19.
Mm-hmm. So at this stage, just before I bring in Kamlesh and Dr. Wasim, the one wider question I have, not necessarily directly related to the product and the technology, is more of a geopolitical one, which is that in the last few weeks, we've seen China increasingly pushing back against India and the US and other countries around the world. This app, given its success and given how it's grown in India, could be a brilliant export product where India could actually say to particularly African countries and other countries, look, don't worry about being overly reliant on China. This is how we can help you. Is this something the government and Niti Aayog has thought about?
Absolutely. So the reason why we went open source was not only because of we were committed to transparency. Now anybody can use the source code to build their own apps. I mean, they don't have to depend on us to use this app in their own countries. The source code is open for everybody. They can quickly build our app on top of it and deploy in their specific countries. So that is there, and we have made a commitment. If anyone needs our help in extending this product anywhere in the world, we are very, very happy to collaborate. So that has always been the commitment. If you see the press release that we had done during the open source, that was a line. I mean, this is in India's effort to make sure that technology common is not just there for India, but is for the rest of the world as well.
Yeah, good. Okay, that makes sense. Can I bring in Dr. Wasim here? So you have downloaded the app, you've used it, and you have a unique perspective because you're a doctor, you run a set of clinics. Do you want to just share your thoughts on the app?
Thanks, Pratik, for that question. Yes, I have downloaded the Aarogya Setu app myself, and as Arnav rightly pointed out and very well explained, that it has got 4 parts to it with respect to capturing the epidemiographic data of the patient or the user. Then we have the self-assessment test scoring, the contact, and the location. Given the set of data points that are captured in the app, and again alluding to encouraging or persuading patients or people to download the app and start using it, most of the concerns echoed by the patients and the public at large with respect to the data privacy and the surveillance. So it would be good if, in addition to highlighting the impact that it has created on the numbers and early detection and so on is concerned, if we can explain and enlighten the audience as to what happens to the data, right, from the various stages, from the in-flight to the data at rest and to the data keys, what happens with the data encryption, what are the legal frameworks involved, and so that will really help in addressing the fears and the apprehensions which are kind of preventing the other half of the population from downloading and using it.
Sure.
Sure, go for it.
Okay, so thanks for Dr. Vashleen for pointing out that question. It's actually a very pertinent one and something that we have been actively trying to address in our communication from day one. If you look at the app, there are three set of data points that are captured at three distinct times. The first is when you register, is when you give your mobile phone number, and an OTP, through an OTP generation, you are registered. At that point in time, you are given a unique, anonymous, randomized device ID. That becomes your identifier from here onwards. The mobile number and the device ID pair is stored one time on the server, and it's kept there in an encrypted format. So data at rest is there in a securely encrypted format using the best of the technologies that we have at this point in time. Related to registration are 4 or 5 fields that we ask for, which is name. It can be any name that you want to be preferred to be called if something happens to you, if you turn COVID-19 positive. Age and sex, both of which are related to comorbidity. We also ask for your profession. And if you look at the drop down in the profession, we only ask for you for professions which are at high risk because they were part of the essential services when we are in the lockdown. And if you have traveled from any high risk countries. So that's the first part of the and this is all stored along with your device ID on the server, one-time exercise. The second aspect is the contact tracing aspect, which is what happens when you and somebody else who has Aarogya Setu installed come in contact with each other. At this point in time, what we do is that we have your specific signature of interaction stored. This is which other device ID you have met, when did you meet this person, the timestamp, for how long did you meet this person, what was the distance between the two of you, and what is the geographic location of this interaction. This information is stored on your phone only using the native encryption key of the phone's operating system. So for Android, it's key store. For Apple, it's keychain. So that is the most secure way of storing any information on a device itself. So Aarogya Setu contact tracing information, which is the Bluetooth signature of you meeting somebody else at any point in time, unless you are COVID-19 positive, is securely encrypted using the native key of the operating system and stored on your phone only. This information is not pushed to the server until you turn COVID-19 positive. So that's the second aspect. The third aspect is when you take the self-assessment test, the result of your self-assessment along with your location is again matched to your device ID and stored on the server. The biggest amount of information that is captured using Aarogya Setu, and the most amount of information, is this Bluetooth contact tracing, which is on the device only, and it's stored only for 30 days rolling. So for example, if you had interaction on Bluetooth 31 days ago, that's get deleted on a 30-day rolling basis. Whatever gets pushed to the server, if you have not turned COVID-19 positive, gets deleted on a 45-day basis. Whatever is on the server, if you have been a COVID-19 positive, is deleted on 60th day after the day you have been cured. There's another clause, which is an explicit sunset clause, which says that irrespective of whatever, any information that may have been retained on the server gets destroyed after 180 days. So there's an overall catch also. So we have made sure that everybody understands that the data is captured for specific purpose and it's deleted after it's no more relevant to us. And the relevance is only for COVID-19 related medical intervention and nothing else. That has been very, very clear in the terms of services, in the privacy policy from day one itself. Unless you are COVID-19 positive, we do not push your contact tracing information to the server, and we only push that so that we can alert other people also. All interactions between two devices, between the device and the server, is done using device ID, which is a anonymized information. And all of this is done using the best of the encryption key, SSL pinning, etc. So we have done thorough testing of all security vulnerabilities while we were in beta stage, while we were just before launch, and before every single release that we do. And since now the source code is open, I mean, for people who are tech savvy, I encourage them to go and test the security vulnerabilities themselves. So we have seen no security vulnerability per se. And one of the reasons why I'll tell you why this has been the case. At the stage of development itself, we had taken one specific decision that we have stuck to. We did not want to use any third-party software except the operating system, so that we don't inadvertently also open ports of data leakage at any point in time. And that we have been very, very paranoid about, making sure that there's no security vulnerability, because we are dealing with sensitive personal information at a very large scale. And that has always been the case. And that's why I said we have designed something which is privacy first. The location information, etc., that the app stores, the location information specifically, again, most of it is on the device itself, and it's deleted on 30-day rolling basis. Even if it's pushed to the server, is used on an aggregate basis and not on an individual basis, which means that we use this information only to understand hotspots, only to understand the areas which needs to be sanitized more, and not for any individual tracking of people. So that has been always been the intent, and that is what has been written. And with the code being open source now, you can verify that for yourself. Till say 27th May, you would have had to believe what we say. Now you can verify it for yourself.
So in other words, will it be correct for me to say that education awareness of this public digital health care app is the way forward in terms of getting people on board to download and use the app?
We have tried our best. I mean, we have tried to simplify it when we were in our option stage. We have tried to make sure that there's an extended FAQ both on the app and on the web in multiple languages. We have made sure that there are advertisements, etc., in regional languages, and that is how we are trying to push for. One thing that we have made a conscious decision. We are not going to make sure that there's an explicit push to the of users to the app. It has to be voluntary. It has to be democratic, and that is what we have stuck to from day one. Again, the voluntary versus non-voluntary part of the app has been misunderstood. And we have always made sure that this is people's choice to help one another in this time of pandemic. And that is how we are thinking that we'll make sure that everybody understands it and everybody tries to download it, especially people who are now moving outside with the lockdown being lifted in a systemic manner. It becomes imperative for all of us to have this app. And that has been our consistent communication. And we have tried almost every communication medium that is available. Social media, I mean, the social media savvy people will be about 70 to 80 million. We've saturated that within the first 3 to 4 weeks. And that's how we have gone regional, we have gone vernacular, we have gone through television ads, radio ads, all those things that we have tried to make sure that people, I think everybody who has a smartphone in India is aware of it. There may be some hesitation in downloading it, and we are very keen on making sure that all of their questions are answered as far as any concern that they may have about security, privacy, etc. We are very, very keen to keep answering them as long as it's needed.
We're starting to get a number of questions coming through. Gurbir Singh has asked a question for Bridge India. In fact, about privacy and Bridge India. It's a very easy one to answer, so I'll just take that first. Why have you chosen to hide the questions and the number of participants in the call? Gurbir, that's just how the feature we have with Zoom works, the webinar function. So that's an easy answer. So Kamlesh, over to you for your thoughts.
Yeah, so Pratik, it's nice to meet you. And hi Wasim. So
Hi,
actually, I'm
Anish.
also using the app from I think last 1 or 2 months, and even I'm also in the self quarantine phase from last 15 days. But when I started using the app, don't have that much trust to use it because we talked about the encryption there and all the GPS location and Bluetooth everything. But as a tech savvy, as I understand the identity management, how the identity should work, I thought why should as Aarogya Setu should use the kind of identity management principles and kind of like self-sovereign identity standards, because as a normal user people can trust about the app, but when come to the tech savvy and the technologist, they understand the functionality and the features. So uh, it's good all about, but I will recommend and to consider the self-sovereign identity standard to be used in the Aarogya Setu app to be give the more trust and transparency to the users.
Can you
That's all.
elaborate on that? Can you elaborate on that? So I may not understand self-sovereign identity as much as you do. So if you could
Yeah.
elaborate on it.
So actually the in the identity space, like earlier, like people generally using any third party like Google ID or maybe any person's ID to log into the systems. But when we talk about self-sovereign identity, so the owner means the user should own the data on their device, and they should maintain their personal information. Should not be shared with the system at all. Means not storing in the servers.
So which is precisely what we have done. So all the contact tracing app, as I information as I explained, stays on the device only for 30 days, and after which it starts getting deleted on a rolling basis. The
Yeah.
only time.
Yeah. So
Sorry.
some exchange is done by you, done in your application, but is not communicated. Means if we talk about the standards and the that self-sovereign and blockchain implementation, so it will increase the and give the more popularity and trust in the system.
Feedback well taken, but we could not find a use case here where a blockchain may be useful. I mean, we may be
No,
wrong, but
and not about the blockchain, just the identity standards.
yeah, so that's what I'm trying to explain. The identity standard that we have used is, again, it's in your hand. I mean, you are authenticating yourself to be a user of the app. Nobody is forcing you to do that by the simple mean of you authenticating your identity using a one-time password. And the second thing is that one-time password gives you a device ID, which becomes your self-sovereign identifier in your words, using which all the information of your contact tracing stays on your device only. The only time we push this to the server is when you become COVID-19 positive, because at that point in time, I have to think of you and I have to think of everybody else who you may have come in contact with and who may be at now risk of being infected of COVID-19. And for them, I have to make proactive healthcare arrangements. Till that point in time, whatever you are saying in principle has been adhered to. Till the point in time, then when I have to take care of you and other people whom you may have come in contact with. So that is the central thesis of it. And you have to understand that the information that we are asking is on your device, and things like name, address, age, etc. These are one-time things, again, directly related to comorbidity, and which is why we ask them. I mean, there's no other incentive for us to ask. I mean, there are already government databases which has more information of you than what we have been asking on Aarogya Setu of your personal information.
Yeah.
So I don't think I think in my mind at least, and I may be wrong, but in my mind at least, the principle that you have just explained is something that we have adhered to in design from day one.
I think just to follow on from that, I think that's a good point Arnab made from a practicality perspective at the end. That actually, if the government wanted to misuse your data, there's many other better ways of doing it. There's lots of other databases with far more data points about people than this app. Can I just briefly get on Dr. Prashant as well? He's also a user of the app, and he has some comments he'd like to share.
Good evening, everybody. This is Dr. Prashant Malur. I'm a professor in Manipal, and I'm also a user of Aarogya Setu, which is there on my mobile. Okay, and very good job from the user, from the developers. But I think I have one or two suggestions to develop this app in a much more rigorous one. 1.1 is it doesn't give me the list of nearest hospitals, okay, which can treat the COVID patients. Because the moment I say, it shows me that you are the COVID patients near you is 1 kilometer or 500 meters or 2 kilometers. It shows me the distance, but it would be nice because most of people are unaware of the hospital list of hospitals, where they can just go to have a checkup, city wise or area wise, whatever. That is for my first one. And second, since I was listening and Dr. Wasim was telling that there could be some issues with the what can I say, the relevance or authenticity of our information and all this stuff. Maybe when the ads were given, when the advertisements were given to download this Aarogya Setu app, there could have also been mentioned that the security or the information is secured. So that most of the people, I mean, it is just hardly a 10-second sentence or a 5-second sentence, that your security, your information is secured. And that would maybe given a large scope of having people without, all these kind of, okay, whether is my data secured or my information secured. But from my point of view, it's not that Aarogya Setu is the only app where I have given the information.
Yeah,
I would have given my information many a times, anywhere, many places, my phone number or my Aadhaar number, Aadhaar card or whatever. So when we don't find that, the issues by somebody else, but misused by Aarogya Setu, I don't understand. But still, just to have one more suggestion. Why can't we adapt having passport number and Aadhaar card number? Why? I'll tell you the reason why. Because it tells me that have you tried? It means that when I download and I try to register, it asks me the question: have you traveled anywhere within 14 days, within the last 20 days? I might be untrue also. I can say yes. I can either say no also. So if I say no, it will calculate. Okay, then you are safe. Only if I say yes, it will calculate the other with all the other parameters. So instead, if I have my passport or Aadhaar card number typed in, and even if I say no, I have not traveled, and in reality, if I would have traveled, it can interlink. It can check with the passport authorities or wherever. Because Aadhaar is by default a card for us now. So that will give you a authenticate data of, without any user misusing it or giving false information. Maybe if I would have traveled, I can just say, no, I have not traveled. And the data what I give is based on trust. So I think these suggestions or these inputs can be added for a betterment of the app. Because as Mr. Arnab was telling, it would be for another 1 year. And we have to live with COVID. We cannot just bypass it and we cannot just keep living ourselves. All right. So maybe these adding maybe a passport or an Aadhaar number to verify whether I have traveled anywhere, that would give a, I can say stronger base.
Yeah. Arnab, your comments?
Yeah, so one clarification. So on the COVID-19 aspect of the app, there's a sunset clause of 180 days, not 1 year. So that is there. On the number of the hospitals information, we already have a version of that. If you look at the app, we have listed down all the ICMR approved testing labs as a resource on the app home screen itself that we have done. As far as storing Aadhaar number and passport number, etc., and people giving misusing information, the central tenet of the app is very, very simple. We are all in a pandemic. we have to have an inherent basis of trust for each other. And that is why we have not tried to ask for more information that is actually needed. I mean, we authenticate you using your phone number and OTP basis, and then we trust you from there onwards. Because we all know that everybody understands that the resources are limited, and we have to help the most needy. That's why we ask you to self-assess. That's why we ask you to be truthful in your information, so that we can provide you the best of information. That is central tenet. We're working on a trust model here.
Yeah.
And Arnab,
I truly appreciate that it is on a trust mode, and we as citizens also need to be so much transparent and honest in updating or giving the information on the app. That's truly appreciated. Hats off to the people who have developed this app, and I keep checking every day whether I am in a safe zone or where I am or how many people are around. But I mean, the only thing is because we know people of India, how people are here and how naughty things they do or whatever nonsense stuff they do. So that was my only thing to add a Aadhaar or passport, is only to give a genuine authentication, so that nobody is have a fake or some kind of that.
Yeah.
I guess you got it. I guess you understood that.
Some comments that are just coming through now. Siju, who's from London, says, a fantastic effort, Arnab, one that many other countries would do well to emulate, not least the UK. It is only a shame that the Indian mass media has not been more supportive of the app, even after it went open source. Ganesh has asked a question following on from Dr. Prashant. Can you share the list of beds available in the nearest hospital in next iteration of the app? And Samir has just messaged to say, is there a citizen think tank where citizens can also participate with Niti Aayog for innovative solutions? Arnab, do you want to start with that last one? That's an easy one for you to answer, I'm sure.
Yeah, so Niti Aayog stands for public-private cooperation. We don't have a specific forum per se, but every single Niti Aayog official's email address and phone number is available publicly. My CEO gets 100 or more emails every day, and he religiously answers most of them emails. If you suggest a technology solution, etc. Sometimes it comes to me, sometimes it comes to other people, but we address and answer most of the suggestions diligently, and we pick up on solutions that make sense for us as a country.
I've got another question from an anonymous attendee. My question to Arnab: we've seen app developers from MNCs time and again face criticism on explicit permissions, data storage, anonymization. More often than not, we see Indians are worried about the same. Even some political figures are expressing their concerns. Aarogya Setu and Bheem UPI have been one of the few apps released by Government of India which have faced similar criticism. Would it be prudent to say that there needs to be consumer education and dissemination a lot more across Indian citizens in order to avoid the resistance and simultaneously support the holistic app development?
Yeah, see, India is a democratic country, and it actually helps us if people are critiquing us on aspects of the app that or any technology product that we build, that actually helps us move in the right direction. And that is something that we have acknowledged publicly also. The privacy policy has evolved over time basis feedback that we have got from the civil society. As far as education is concerned, I think several of us are enough, have understood the product enough in a sophisticated manner. There are some people which we can't convince enough, but we are trying to do our best. The point is very well taken. Everything that we have done, we have made sure that we have made that available in the public domain from day one, except the source code, which we did eventually. We have been very, very open and transparent. If we have goofed up, we have accepted that publicly. And there was at least one instance where we said there was an inadvertent error in the way we are interacting with the Google API. We put a statement on our Twitter account. So we have been very, very transparent as far as the process is concerned in the development of this app, in making sure that who has access to the data, etc. That has been very, very transparent. Only people who have a direct involvement in COVID-19 have access to the data, and through a secure VPN tunnel, and everything is logged. So we know who have access, what information, and everything is on a need to know basis. Those things we have taken care of. I do appreciate the suggestion that a more public awareness should be done. And I think that's the beauty of a country that is democratic and as diverse as India. I mean, we have to make sure that everybody understands and truly appreciates what we are doing when you are doing at this kind of a scale. And something people need to appreciate is that when you are when you are operating at a, say, a 500 million or a 1.3 billion scale, most people will think there are some cases which may be edge cases. But at this scale, every edge case is an actual case which may impact, say, 2-3 million people. So that's why we have to be extremely paranoid in what we are trying to do and making sure that people try to understand it. But feedback very well taken.
Okay. Some questions from Siddhi on the chat. I want to take one of them for you, Dr. Wasim. How can this app be modified post-COVID to improve medical management for users? Have you got any thoughts on that?
Especially for chronic disease management like diabetes, hypertension, heart disease. At the moment, the attention consciousness is focused on COVID-19. But I'm more concerned about the looming pandemic of chronic diseases. What has happened in the last 2.5 months is patients have not been able to follow up with the doctors. They are sitting tight at home. They are unable to, follow up on their blood tests and so on. This has invariably, resulting in developing complications. So now that the lockdown restrictions have eased up, and mind you, the patients are still fearful in terms of visiting doctors and clinics. There are stringent protocols being followed in terms of not having relatives accompanying the patients and so on. So as an extension to the Aarogya Setu, which Arnab and Niti Aayog has done a fabulous job, it would be great to add more features in terms of capturing the data on the chronic disease management side, whether it's the blood sugar or the blood pressure or the vital parameters. Also, I would love to see repeat prescriptions, which is a concept where as part of telemedicine, we have remote patient monitoring. So we can, again, as Arnab rightly pointed out, COVID is here to stay, and we have to be, cautious for maybe for another 6 to 8 months. So having these features inbuilt in Aarogya Setu will not only ensure that patients who are suffering from chronic diseases are looked after, they feel reassured in the fact that they are connected to the doctors, and having a repeat prescription component inbuilt will help streamline the treatment and the management protocols.
Makes sense. Any thoughts from you, Kamlesh?
So even like Arnab mentioned, it's the kind of privacy and security enabled in the application, but is not communicated that way. Like looks like you need to trust on the who built the application. But if we communicate and if we at least talk about the any particular marketing perspective, like how the apps use the security and the privacy, and if we talk about that DID standard, so people will trust that much.
Another comment just came through from Gurbir. No question, but a request. Please pass on my compliments to Arnab Kumar and others involved in the choice to go open source. Very significant step. Muskan asks, people can easily insert fake answers in the app. How can we trust an app like that?
So again, see, there are multiple aspects to the app. The first aspect is your self-assessment. And we have made sure through design, we ask you to confirm what you're answering, because what you answer helps us plan for your own health. But the contact tracing is not done through you inputting something. It's basis your Bluetooth signature, your RSSI information that is through Bluetooth. So contact tracing, very difficult for people to manipulate at that level. So we are okay from a Bluetooth contact tracing perspective, which is the central core spirit of the product. From a hotspot prediction, also it's at an aggregate level. So again, we are fine. From a self-assessment level, see, that's what we have done. We ask you to self-assess yourself and give your response, and then we follow this up with the doctor. We have a subset of people who are triaging your conditions. So if your conditions are not what you have suggested, then the triaging can be that out as well. But again, trust model.
Yeah, I want to take 3 questions together because they're all related. Question from Siddhi says, a comment on something you said a bit earlier about the 30 days the data is stored. Siddhi says 30 days is a long time to store data. How do you come up with these timeframes? And then following on from that, in terms of how that data is shared, she asks, in Singapore, the government has explicitly said from the beginning that data would only be shared with the health department and with nobody else. Can India make that statement? And if so, just as a follow-on, I think this was an anonymous question that came in. Is the data from the app available to city commissioners, or is it just reviewed at the center? Can cities and lower levels of municipal government also access the same data
Sure.
and make their own predictions?
Yeah. So see, why 30 days? So it could have been 1 day, 2 days, 15 days. The simple answer is the data is getting destroyed on a periodic basis. That is important. The second aspect of that is that based on the early studies that we had seen, we understood that the symptoms can remain from, or the infectivity of a person could remain all the way from day 0 to day 28. 14 to 28 could be an outer bound. And that is the reason why we have retained the information for 30 days so that we can fire a contact tracing for that person for 30 days and access the risk of infection. That is that several countries have taken different approaches. Australia, for example, is 21. So the important aspect here is that data is not retained beyond a period, which we think is after which if you have unfortunately contracted COVID-19, you are no more infective to the rest of the society. That is the first answer. The second answer is while Singapore was the first one to come out with a contact tracing app, we were also in a similar phase of development while they were developing. Sometimes I find it's slightly unfair if we are being compared to a country like Singapore with a population of 5 million people and where some of these healthcare interventions are, I wouldn't say easy to do, but are much more defined compared to a country as diverse as India. 5 million downloads we reached on day 1 itself of launch. India's administration of healthcare is not one ministry, one department led. And COVID-19 response for India has been interministerial. It has spanned across multiple entities, multiple departments, because of the sheer number of people that are there in this country. And that is the reason why we haven't said that, oh, this is the entity X which will have access to the data. What we have said is that there's an entity which is the fiduciary of the data, which makes sure that the data doesn't go in the wrong hands, which is National Informatics Center. There is the single point of fiduciary for all data. All data is only given to people on a need-to-know basis, only of the portion of the information that they need. So there are people in the central government that have access to the data. There are people in the state government that have access to the data for their own state, for the limited purpose of COVID-19 intervention in their state. There may be information available at the city level, or in India, the denominator is district. So at the district level, and only for their district, again, for direct COVID-19 related medical intervention. And we have a very specific log of whom the data is available to and what specific action they have taken. We have a very intelligent dashboard powering all this information dissemination. And we have made sure that all the best practices of data privacy and security are taken care of while we are trying to address this intervention on a scale of a country as geographically and demographically diverse as India.
I just, we've got 5 minutes to the end. I just want to bring in Dr. Prashant for any last comments he might have, and then we'll do a round of summary with everybody.
My last comments would be, I just scrolled the app after Mr. Arnaud told me that there are a list of labs, but labs, they are just a testing lab. Okay, but it would be great. I mean, it is for the people, to help the people. That's it. Because few days ago, I was seeing some people getting panicked in Delhi hospitals or any of the other hospitals. So, and even at the people at rural areas. So, they also must get an awareness. Hence, that is the reason, I mean, what I suggest is maybe a list of the hospitals and the beds they have, what is the facility they can go through. And,
Sure.
There is also a fear that, if I am going to a private hospital, they charge me very, humorously or exaggeratedly kind of, but what is the actual fare, or what would be the price for testing? These small informations would make this app a much greater app. I'm not saying it is not great. It is great. It has evolved to be a great one. But with these more additional informations, what the people need, because people cannot keep trying the helpline every. When I'm in a panic situation, I cannot keep calling people or keep going to the helpline. So it has to be like the one button with Aarogya Setu. I get to know what is the nearest lab, which is the nearest hospital, how many beds available, where can I reach immediately, so that I can just call the ambulance or take my own vehicle and rush to the hospital.
Got it.
Then, because yesterday or day before, I was seeing, a person was made to run around among 5 hospitals, which is loss in time. Major of the time has been lost. So I think these can make it much better and bigger. That's it.
Sure.
And also with the rural, with the rural connecting rural India or rural people, because rural people also have they have made their own security, and they are not leaving any other people. But still, if at all they get, which is the nearest town hospital, which is the nearest town, which hospital, how many beds. If it is government hospital, the state of rural, government hospital in rural India, there are hardly any, doctors. So who would be the doctor? These informations would give them a strength. That is it.
Okay.
Nothing else.
We're just running short on time now. So I just wanted to get
Thank you, everybody. Thank you, panelists.
Thank you so much.
Thank you.
I just wanted to get quick closing remarks from Kamlesh, then Dr. Wasim, and then Arnab at the end. And then we'll just wrap up.
So, yeah, Arnab, so it's a good application and I'm using it. But I have some concern recently, because so if we make the use the application mandatory by all, so it will good impact, because in my society there are 2 positive cases, but this is not appearing in my application because maybe they are not using it. So if you make it compulsory to use by everyone, then it will be really beneficial.
Sure. I'm not going to comment on that. I mean, there have been already too much discussion in the public domain on that.
Okay.
Dr. Wasim?
Thanks, Pratik. From a patient standpoint, and having public at large to engage more with Aarogya Setu, I think patient awareness, public awareness, education holds the key, not only in terms of getting them on board, as well as building up that trust, with respect to the various points that have been covered very well by Arnab, whether it's data privacy or the various aspects of the data and from the tech standpoint.
Arnab?
Yeah. So, Pratik, Bridge India, thank you very much for hosting me for this session. I hope I could answer some of the questions. The technology development for Aarogya Setu has been an evolving process. It's a phenomenal example of public-private collaboration. made by the best of India for India, keeping in mind the unique challenges that India has in addressing COVID-19. And we have evolved as a product from day one of launch to this date, and we keep evolving. That's why all the feedback, all the suggestions are very welcome, and we actively keep working on these suggestions. And that's how you'll see that product has evolved a lot since the launch on 2nd April. What we have also learned is that this actually sets a template of how do we rapidly build and iterate on technology solutions in times of need, both in times of a situation like COVID-19 or also in terms of broader challenges that India may have. So if you have suggestions, etc., on what kind of technology interventions you want to see in post-COVID-19 world, feel free to reach out to us and we will be happy to engage on those suggestions also. Aarogya Setu is still an evolving product. So if you have suggestions how you want to make this better, how to make sure that this reaches every single phone in this country, happy to engage on that as well.
Okay, thank you, everybody. There's a few more questions still coming in. I'm really sorry we haven't been able to take all of them. Thank you to Shashi, to Ganesh, to Samir, Siddhi, and all the others that have put questions in. This has been a great session. Samir has just asked, how do we reach you? So Arnab is on Twitter, as are, and also on LinkedIn. I think all of us are very easy to find on LinkedIn. So please do find and connect with us. Please follow Bridge India on LinkedIn and Facebook. Tweet at us, good comments, bad comments. Tell us sessions are boring. Tell us sessions are great. Whatever the comments are, please keep them coming in. And if you are free tomorrow, then our next session is remote learning in higher education in India here to stay. And we've got vice chancellors from a number of universities in India, as well as from outside India, and a couple of students who are doing online-only courses to give their feedback. I'm sure we'll cover data privacy and security tomorrow as well in that session. That's been a running theme through some of our webinars. But thank you all very much. Thank you to Arnab, Kamlesh, Dr. Wasim, and Dr. Prashant as well. Have a good
Thanks, everyone.
day.
Thanks, bye.
Bye.
Thanks, Pratik. Bye.